Hello, this is Dr. Brian Culp. In the coming days, you're scheduled to return to my office for a preoperative visit with my team. This visit has several purposes which we'll outline below. Number 1 is to ensure that all the x-rays needed for your surgery have been completed. Number 2 is to discuss the risks and benefits of your upcoming joint replacement surgery and to sign surgical consent forms. Number 3 is to review the details specific to your needs and to ensure our surgical experience is tailored to you. And fourth, answer any outstanding questions or concerns that you or your family may have. I prepared this short video to get you ready for your upcoming surgery. Firstly, I'd like to take a moment to tell you that joint replacement is a life-changing surgery. It can take away the pains that have been plaguing you on a daily basis or precluding you from sleeping. It can restore the function of your leg and improve your stability and help you get back to the hobbies you once enjoyed, such as hiking, biking, golfing, or simply even being able to take a walk. Advances in surgery have allowed us to take this complex procedure and make it safe and effective for the many people requiring joint replacement today. There's a lot of complex parts to this procedure, so please listen on. It is important that you've attended our joint replacement class before attending your preoperative visit, as this class often touches on many frequently asked questions. If you haven't attended this class yet or not done so within the last year for another joint replacement, please let our team know as soon as possible and we'll help coordinate this for you. If you have other major health issues or see a subspecialist, we may request secondary clearances from those providers as well. My surgical scheduler will notify you at the time of booking your surgery if those are needed. If not, a note from your family doctor will be all that's needed. Patients often ask, what time is my surgery and when do I need to arrive? This depends upon a number of factors, including your other health issues, when or if you're going home that day, the other surgeries scheduled that day, and the resources that are needed to perform your surgery safely. You'll receive a call within 1 business day prior to surgery letting you know when to come. If your surgery is scheduled on a Monday, the call may occur on a Friday. Please be sure to be on time for the time slot provided to you. After check-in, you and 1 family member will be shown to the preoperative area. There, you'll be changed into a surgical gown, wiped down with sterilizing wipes, and an IV will be placed in your arm. You may be given some medication before surgery that will kick in while you're sleeping to ensure a more comfortable wake-up in the recovery room. I'll be by to greet you before surgery and answer any questions. We'll also be confirming that we're doing the correct surgery on the correct leg and making markings on that leg before our procedure. Afterwards, the anesthesiologist will be by to discuss anesthetic specifics. Most patients are able to complete the surgery under spinal anesthesia. This is a very safe and effective form of anesthesia for joint replacement surgery and by far the preferred means of anesthetic. Typically you'll be sedated first, and then a numbing medicine will be injected into your back so that your legs feel numb. For most patients, the sedation means that they won't even remember that the spinal occurred, and the next thing you'll remember is waking up in recovery. Surgery typically takes 1.5 to 2 hours to complete. You'll be sedated in a twilight sleep, so you won't remember anything until you wake up in recovery. After surgery, you'll spend some time waking up in the recovery room. You may experience some pain after surgery, and the nursing staff will provide you medication to help control your pain. Once we know that your vitals are stable and that your pain is controlled, we'll get you out of recovery and headed toward physical therapy. Many healthy patients can go home on the same day as the surgery. If you have other health issues, lack home support, or have discussed with us previously, you'll be planning to spend the night. Most patients who do require a short stay will be safe to be discharged within 24 hours. There are some circumstances where your health issues or your preoperative physical abilities will require you to have a longer stay at the hospital. Some patients may even require a short stay at a rehabilitation center. This is not typically the case, as 95% of patients will be safe to go home after the surgery. If you do require additional resources, those will be arranged for you after the surgery is completed. The length of the recovery process has to do with a number of factors, including the complexity of your surgery, your overall health, your age, and your general condition going into the surgery. For most patients, the recovery process takes on average 2 to 3 months, but many patients continue to improve for up to a year after the procedure. You will have some pain during your recovery process, and these can be managed with oral medication so that you can move and succeed well with your physical therapy. We will be giving you a number of medications after your discharge. I hope that you follow through with our instructions, as each of these medications serves a specific purpose. While we will be giving you a small amount of opiate pain medication, it is our hope that this medication can be minimized in your recovery process. If you are amongst the small percentage of people who require opiate medication long-term, we will facilitate a referral for you to a pain management specialist. A joint replacement typically lasts 15 to 25 years. In order to maximize the longevity of your joint replacement, we hope that you continue to participate in low-impact exercise, maintain your body weight, and your overall health. As with any surgery, there are specific risks to this type of procedure. One of those risks is anesthesia. Modern anesthesia is extremely safe, and the risks typically include simple things like post-operative nausea and urinary retention, which are often short-term. Risks of cardiac, pulmonary, and neurological complications are extremely rare. In surgery, we'll be making an incision into your body. This incision will be closed with dissolving stitches in glue so that you can shower. As with any incision, there is the risk of bleeding, and so the rare chance of transfusion will be discussed with you before surgery. Whenever we make an incision, there's always a scar. While we will use plastic surgical techniques to minimize the visibility of that scar, you'll always be able to see some portion of the incision. As we go through the skin, some of the nerve endings of the skin can be damaged, and for some patients there is numbness after the procedure near their scar. For a small percentage of people, this numbness can be permanent. When you open the skin to the outside world, there's always a risk of infection. This risk is less than 1% chance. We take this risk of infection very seriously, as post-operative infections are a serious event and may require prolonged antibiotics or an additional surgery. On top of the sterilizing wipes you are given for surgery, we'll also sterilize your limb in the operating room before the procedure. Antibiotics will be given both before and after surgery to minimize these risks. It is important that you follow good hand hygiene and follow instructions to prevent infections. Blood clots are possible when you operate on any body part. While these are extremely rare, you'll be given medication to decrease the risk of developing a blood clot. It is important that you walk once or twice every hour to get blood flow to the legs, and you'll be taught exercises such as calf pumps and leg squeezes to help get blood flow even while you're at rest. There are nerves and arteries in your body around where we're working on your joint replacement. These are carefully protected during our surgery to prevent damage to these structures. Injury to these structures can be threatening to your limb or even your life. Again, however, we take careful precaution to protect these during our procedure. While typically uncommon, when we restore the missing cartilage or realign your limb, some patients perceive a temporary lengthening or shortening of the length of their limb. This perception is often temporary and resolves as you get used to your new joint replacement. As the joint is surgically manipulated, it does have a risk during the early phases of your recovery of becoming unstable or dislocating. We take a number of precautions to prevent a dislocation, and will provide you education on what activities to avoid during the early recovery to prevent a dislocation. Swelling and bruising are common after surgery, and it's important that you take steps to prevent these normal side effects. This includes elevating your limb above the level of your heart for several hours each day during the first few weeks of recovery, as well as icing for 30 minutes to 1 hour during those first few weeks. Swelling may take several weeks to a few months to resolve after surgery. Some patients notice clicking during the early phases of your recovery, and this should fade as the swelling improves. Most patients experience a marked decrease in pain and an improved quality of life. However, a small number of patients do say that this does not feel like their natural joint, or that they still have some minor pains. It is important to remember that this is an artificial joint and may not feel identical to your natural joint. When you come in for your preoperative visit, you'll be signing some paperwork and reviewing the risks just described. It is important to remember that these risks are extremely rare. If you have any questions, please don't hesitate to ask. I would like to note that we occasionally have observers in our operating room learning about joint replacement. These include nurses, physical therapists, and other doctors. I would like to assure you that I perform the entire surgery and I do not have trainees in my operating room. The only exception to this is the final layer of stitches that may be completed by my physician's assistant. I do perform research, educate, and design medical devices for which I receive financial support. None of your personal information is ever disclosed when performing these academic endeavors. As a closing note, I'd like to circle back and tell you why I love performing joint replacement surgery. I think that knee and hip replacements are a wonder of modern medicine. Many patients have grown accustomed to pain being part of their daily routine and lost the ability to enjoy their lives. Joint replacement surgery has been revolutionary at undoing these limitations. Personally, I've had several family members go through these types of procedures, including 5 knee replacements and 2 hip replacements. I've seen firsthand how life-changing these procedures can be. On a daily basis, I get to see patients go from debilitating pain to restoring their function to a normal, happy life, and I feel grateful to be part of their story. I look forward to you getting your life back.